I have chronic bronchitis. I get a flare 3 times a year. Is that dangerous? Well, yes, it is. Every time you get a flare of your chronic bronchitis, it can cause some damage to your lungs. Let's back up a little bit. What is chronic bronchitis? Well, that is if we're producing mucus for as much as 6 weeks, 3 months out of the year, 2 years in a row. Lots of definitions for chronic bronchitis, but it's bringing up mucus on a regular basis that's not just secondary to a cold. That can advance to COPD, chronic obstructive pulmonary disease, and that can even lead on to the end of that spectrum, which is emphysema. Now, it's very common that people with chronic bronchitis, chronic cough, cigarette smoker's cough, rattling cough, get flares where they get an upper respiratory infection and they really get short of breath and they really get air hunger and they're really hurting for air when they get that bronchitis. There's a new study that says the people that have had that last year probably can expect to get it this year. That means there's probably a pattern of people that get recurrent bronchitis. What do you do for it? Well, it's very, very important that if you get a flare of bronchitis on top of your COPD, that you get to your doctor. He may want you on a tapering dose of some prednisone. He may want you on an antibiotic. He may have you use a nebulizer to help open up the lungs, to clear up the lungs, and help get you better. So know that that chronic bronchitis with a flare needs to be treated, because if it goes untreated, it will slowly begin to damage your lungs, where you'll have to start having oxygen and regular medications to stay well. Treatment for chronic bronchitis, chronic obstructive pulmonary disease, we know that medicines like Advair, long-acting bronchodilators, with an inhaled steroid, very effective. A medicine called Spiriva, which also works a different way to open up the lungs. If you've got chronic obstructive pulmonary disease, your doctor knows those medicines. Be sure you're getting on a good medical program.